Welcome back in with more Americans turning to popular weight loss medications like Ozempic and Wegovy. A surprising side effect is now making headlines. It's being called Ozempic face. Here to explain what it is and how we can prevent it is Dr. Sethi from Renew MD Medical Spa. Dr. Sethi, always great to have you.
Oh, thank you, Rachel.
So excited to have you. This is something that we've seen this word again and again, Ozempic face. So people know Ozempic really helps people lose weight, which can be great in some cases, but there's this side effect. So tell us a little bit about what it is.
Yeah, so Ozempic is actually in a class of medications called GLP-1s, and in that there's Ozempic, Wegovy, Zepbound, and so forth. And I'm pointing that out because we'll later on talk about how to avoid it.
Okay.
But Ozempic face is essentially a term for all the sagging skin you get after you've lost a lot of weight very quickly. And it is kind of specific because, you know, people have been losing weight for centuries, right? But why is Ozempic face so different? And it's actually because people are losing even more facial fat and also, I think, some muscle mass in the face that is causing this very excessive sagging and also very quickly. So that's why it has its own term.
Okay, so we've heard the term. Now, have you actually seen this happening?
I have. So on social media, you'll see a lot of celebrities who are, you know, victims of Ozempic face, right? But I've seen it, and I've seen it over the years. You know, sometimes we have patients who are bodybuilders, and they are training for a competition, and they lose a lot of fat in their, you know, their fat percentage goes down, and that includes their face. And I have seen it. We offer weight loss in my practice. We don't use Ozempic. We use another medication. However, I've seen it, but I've also have seen how to avoid it, which is actually even more important because this is not a reason to not lose weight with these medications, but we should know how to avoid it, and there are ways to do that.
Okay, wonderful. So are certain people who may lose weight really fast more keen to maybe get this?
Yes. So if you're already someone with sort of a lean face, you are more likely going to get Ozempic face. Also, there, you know, if you're going through a weight loss program very rapidly, and you know, rapid weight loss has never been the way to lose weight. And this is just an example of what happens when you do lose a lot of weight.
Okay, and can you describe to me what does Ozempic face look like? What does it present?
Yes, so Ozempic face specifically looks like a lot of hollowing in the temples, a lot of loss of volume in the cheeks. And if you think about, you know, our skin, when we think of a sagging skin, we're always thinking of skin. But actually, our skin is actually anchored and lifted up by facial fat.
Okay.
And all that lifting occurs in the top part of our face. So when you lose fat there, all that lifting and anchoring that was happening is just like falling down. But these are very drastic ways of describing it, but that's essentially what happens. You lose fat here, and that just gives a more aged and tired appearance also. Okay,
people, of course, are not going for aged or tired.
No, those are not things they're going for.
So how can we prevent this from happening?
So that's the good news. You know, these medications have been around for a few years now, and we've learned how to. First, we've learned that this occurs, and then how to prevent it. Number one, the choice of medication. So in my practice, I like to use the medications like Zepbound and Mounjaro, which the generic is tirzepatide. It has a 40% less chance of muscle mass loss, which is a big contributor to this Ozempic face. And then second, gradual weight loss. You know, a pound a week is a very nice gradual rate. Anything more rapid than that, you are likely going to see a lot of these facial and skin changes.
Okay, amazing. And if people are seeing those changes and maybe they're saying, oh no, is it too late? My skin has already changed. I have Ozempic face. What should I do now? No, so there are actually really nice solutions, and they include things like, you know, strategically and conservatively placed filler, biostimulators, collagen stimulators, and other ultrasound lifting. There's just a lot of things that we have available now that can very effectively reverse that as well. And I want to touch on this because you always mention being very conservative with the filler or whatever it might be that you're doing. Tell us why that's so important to you. That's important because everyone wants to look like themselves, but a better, younger version. And I think fillers get a lot of bad rep because sometimes we see them
poorly placed,
right.
and everyone assumes that gives you an overfilled sort of pillow face, and that's not the case. But then also that is why you go to a professional, and also a professional who has the same style as you. That's equally important.
Yes, absolutely. Yeah. All right. So now, if people are considering doing these weight loss drugs, are there certain people who might be more susceptible to getting Ozempic face that should be prepared for something like that?
Yeah, I think if you're somebody who has sort of a leaner facial structure naturally, I also think women who are going through menopause, that's another group that kind of naturally is losing facial fat, naturally is seeing more skin sagging issues. So they're going to naturally then also be more susceptible to Ozempic face. But again, the key is doing that weight loss gradually, properly with a professional. And also there are ways to address it. So that's actually even better.
Wonderful. Any last tips for people who might be concerned about this or who are going through this?
So I think I don't want people to think that going through a weight loss program with GLP-1s is dangerous or it has a lot of adverse events. That's actually not the case at all. In fact, we have even more positive data now that they've been around for a while. So this is just one aspect that is fairly common, but you can reverse it or you can even prevent it. So that would be my tip.
All right. Well, Dr. Sethi, so great to know. Thank you so much for always sharing all of your knowledge and your information with us. Thank you so much.
You're welcome.